everybody. 2024 is in full swing, and if you're like a lot of people, you might be thinking about ways to take better care of yourself this year.
Yeah, and well, our next guest says that our gut health can have a major impact on our overall health and our quality of life. Here with some important information about the most common gut issues that she sees in her practice is family physician, Dr. Sheila Wijayasinghe. Welcome back to the show. Good to see you.
So, Dr. Sheila, let's start with the basics, because a lot of people think gut, and they think, well, maybe it's just tummy, but what part of the body are we actually talking about?
So when we talk about the GI tract, we talk about gums to bum, basically. So
Sorry, what?
I love
gums
that.
to bum.
Gums to bum.
So we start with the mouth, the esophagus, the stomach, the small intestine, and the large intestine, ending at the rectum. So that's your GI tract.
Okay.
That's your gut, as
That's
in
your
gut
gut
health.
gut health.
Got it.
Okay. So how big of an impact can gastrointestinal, or GI as we know it, have on your overall health?
It's huge. So your GI. So people think that we're obsessed with GI health. When you come to the doctor's office, we ask about your poop, we ask about your bowel regularity, and it's such an important topic because your gut health really influences the rest of your health in so many ways. So nutritional deficiencies happen because there's issues with the gut. So vitamin deficiencies. The gut is also very rich in the immune cells, and so if you have a malfunction happening, it can also lead to issues with fighting infection. We know that there's a strong brain-gut connection as well. There's so much serotonin in the gut that it actually influences our mood and our anxiety levels as well. And we see that very commonly in conditions like irritable bowel syndrome, where people who get anxious may have symptoms of constipation or diarrhea as a result of that strong connection. So we know, and people with chronic diseases like Crohn's disease or colitis, that can really affect your quality of life. So overall, it affects not just your physical health, but also your emotional state too.
Wow, that's great information. Well, obviously, it's a very important part of our body. So what are the best ways that we can take care of our gut health?
So I love talking about this with my patients. So one of the things I first say is, like, get a good habit going, like a good routine, just like anything else in our life. So you want to make sure you have enough fiber, fluid, and exercise to get the guts moving and have a regular system. The next thing is knowing what triggers you. So we all have different sensitivities to different foods, but the common culprits are things like anti-inflammatory medications can cause reflux. We also know that certain foods like caffeine, alcohol, spicy foods, fatty foods can also wreak a bit of havoc on our gut.
I was like, check.
The things that we were just talking about with the Mediterranean diet. So it's important to know that what bothers you, what doesn't. And then also knowing your own routines. If it changes, get checked out. And finally, screening for your colon health is really important. We underscreen in Canada. We start at age 50, earlier if you have risk factors, but it's something that if we can early detect, we can cure it. So that's what I always want my patients to know that too.
Okay, well, a lot of people think they may have some good knowledge about their GI tract and their gut health, but we're going to put it all to the test now. So, audience, hosts, we all have our paddles here. We're going to ask you some true or false questions. Well, we're going to ask the question. We decide if we think it's true or false, okay? Let's see how we do. So the first question is this. A colon cleanse can help ensure you have good gut health.
Yeah. So it's
I'm
false.
gonna say false, yeah.
It's false, yes. But it is a huge moneymaker. So I want you to all save your money. Colon cleanses actually can be harmful to your health. Your body does not build up toxins if you're digesting normally, which most of us are. And so the need for a colon cleanse is just a waste of money. And it actually can disrupt what's called your microbiome, which we're learning more about. It's the natural balance in your gut of bacteria, and a colon cleanse can ruin that. So you don't want to do that. Save your money. Avoid doing that.
Okay, next one. True or false? The more fiber you eat, the better.
Oh, that seems obvious, right? That's a true. Fiber's good for us.
I think
We
there's
just
a
learned
limit,
that.
but I'm going to say true.
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 So most of us actually don't get enough fiber in our diet, and fiber is amazing. It has so many functions that we don't think about. So certainly it helps with digestion and regularity, but it also reduces blood sugar absorption. So you get actually less sugar in your blood, decreasing the risk of diabetes. It holds onto cholesterol and excretes cholesterol. So if you have high cholesterol, fiber is really important. It also reduces your risk of colon cancer. So those reasons, but we aim for, the recommendation is 25 grams a day. Most of us get about 10 to 15 grams a day. So the way that you want to increase it is looking at the boxes of your cereals, see how much fiber is in it. There's certain fruits and vegetables that have higher fiber than others. So like a pear or an apple has 3 grams of fiber. An avocado has 13 grams of fiber in it.
I've had both those things so far today.
You're good.
Fiber full.
You're
Yes,
fiber full.
full of fiber.
It's supplementation, yay or nay?
So if you have trouble getting to that number, using psyllium or those kinds of brands, that can be helpful just to get you there, because we're really under treating our fiber, and it helps in so many ways.
Okay.
Yeah, I was also told to have my fiber early in the morning. Does it matter when you eat your fiber?
Doesn't matter.
Okay, that's what I thought.
Just get it through. But the main thing about fiber, I have to say, is you're getting fiber, you have to have water with it.
Yeah, to keep
because
things
fiber,
moving.
if it sits like a rock in your stomach and your gut, and if you need water to infuse it, and then you'll go. But if you don't have both, then it causes
Got
issues.
it.
Okay, good to know. All right, our next question. True or false, gluten is bad for your gut health? I'm gonna say this is false.
I'm gonna go with a false.
Yeah.
So it's false. Gluten's actually good for your gut health.
What?
And so
tell us
unless
more.
you have gluten sensitivity or an autoimmune condition called celiac disease where you can't digest gluten and it causes damage to your intestines, gluten is actually healthy for your gut. It feeds your microbiome and the bacterial balance, so it actually is quite healthy.
Yeah, and I feel like just like 10 years ago, everybody was talking about, gluten-free, gluten-free this, gluten-free that. So how do you know if you have a gluten intolerance?
Totally, this is a great question, and so you don't want to commit to a gluten-free diet unless you know you're actually intolerant. So one way is with sensitivity, elimination from your diet to see how you feel. The next step is actually, for celiac disease specifically, we have a blood test that we can do. The caveat is you have to be eating gluten in order for it to be accurate. And the other piece that we can do is a biopsy in a scope. So if you're having issues, it's always good to get checked out because we want to make sure that we're treating the right thing.
Okay.
Okay, next question up is true or false? Food intolerance tests diagnose gut issues.
Food intolerance test diagnose
Gut issues.
Yeah, false.
It's
so
false.
It's
It's
false.
It's
So
false? Oh,
So
okay.
very similar to the colon cleanses. These are a big money maker. There's no validated food intolerance test that really will help you, so avoid it.
Okay. All right. Here's a fun one. True or false? We should all be keeping an eye on our poop.
Oh, God, yes. Put it on a T-shirt.
Yeah.
Put it on a T-shirt.
Yeah, you should be looking at it before you flush it, right?
This is my line.
This
Look
is
before you flush, because it's important. So it is true. So we have to look at it, and it's hard to think about this. So we have to take a page out of our kids' books. They talk about poop all the time,
All
and they're
the
not
time.
afraid of it. It's become a shameful topic, but poop tells you so much about your
My
health.
daughter was a fart for Halloween.
Oh,
So
amazing.
that was
Amazing.
her costume. She's 5. But I got the conversation
So
going,
let's
that's
keep that
for sure.
going. It's normal. We all poop, right? So it gives you clues. So the one thing that I always tell my patient, if your stool regularity changes, if you're once a dayer and it changes to once a week, and it's a consistent change that lasts for a long time. So once in a while, you can have a couple days where it's off. But if it lasts for 3 to 4 weeks, get checked out because that can be a sign that something else is going on. Or even the size of your poops change, like to pencil thin and it's consistent, that might mean there's something more serious going on too, and it's consistently lasting for a long time. The other piece is the color. So look at the color. Black tarry stool can mean there's bleeding happening in the upper GI tract, and as it travels down, it turns to black. Pepto-Bismol and iron supplements can also cause that issue. So just a side note, red stool can mean bleeding. So you want to make sure that you don't have hemorrhoids, which are benign, but more serious things are diverticulitis and otherwise. And then finally, pale stools can lead to mean that there's something in the gallbladder or liver happening. So look at your stool. We all poop. Talk about it. If there's a change, seek help.
I love that. Put it on a T-shirt.
Yeah.
Look back.
That's
Do
it.
the look back before you flush. Dr. Sheila, we love having you here. We always feel so much smarter. So thank you. Okay. That's the takeaway today. Look at your poop, people. We're going to be back right after this.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.